Hello there, good people of Ain2. How are you getting on there today? Um, Thanks very much for tuning in to the weekly broadcast on the Ain2 Facebook page and the Ain2 YouTube page. This is the second week running now that we're also broadcasting on YouTube. And it's been a phenomenally busy day here in Leinster House. As we say in Navan, we've been flat out in fifth all day long. There's just been so much going on today. I was questioning the governor of the central bank with regards what cost credit is for the banks. The ECB is giving really cheap credit to the banks in Ireland, but they're not lowering the interest rates to the end user. And actually, they're putting up some of the bank charges at the moment. We were debating there just on the mother and baby homes in the Dáil. There's a plan by the government to bury testimony made by the former residents of these homes for 30 years, which is outlandish and outrageous decision by the government on that. I will be speaking in the Dáil later on tonight around new information that we're bringing out on a cervical check scandal. This is really, really important information into the breaking this evening. And I'll be introducing that into the Dáil around 9:30. So if people are watching Oireachtas TV, they'll have a chance to look at that. We've been raising issues around schools. We did a good bit of research on the incidence of COVID in schools, where it's happening. First of all, strangely, weirdly, the minister hasn't given this information to teachers, hasn't given this information to the unions. There's been about 10% of the schools have been tested around the country. 70% of those have been on the East Coast, which is interesting. You know, this country is phenomenally biased towards the Dublin area with regards to service, and this is no different. And we've been hearing from students that they're waiting, you know, well over a week in some cases to get a test done for them. So we've been working on that today. I also questioned the Taoiseach. I'll talk about that a little bit later on in the broadcast when we get to the main issue today. So there's been a good deal of work. We in the regional group, in which Ain2 is a part of in the Dáil, also launched a motion, a private members bill, to try and get more investment in post offices. Believe it or not, post offices around the country next year will on average make a loss of €20,000. People know that the government have gutted the number of post offices around the country already in the last number of years. Indeed, over 100 were taken out of the system in 2018. There are 900 post offices left. It's reckoned that the €17 million hole there at the moment with regards to funding, if it's not plugged, we're going to see hundreds of more post offices closed. We also know that a lot of small regional rural towns and villages are tremendously dependent on their post offices. If they don't have those post offices functioning, they're not going to be able to do business in the towns. You know, people go get their pensions, they get their social welfare, they take money out of the post office, they spend it in the local town or village. Post office disappears, much of that business disappears as well. And it's increasingly important as a location where people can meet each other and have some level of communication in this world where people, I suppose, are losing that skill, losing that important human interaction that is vital, for our, physical and mental well-being. So we put forward a bill today in Leinster House to make that happen. People will also realise that we put another bill, Ain2 put a bill there recently in with regards to the theft of pets in this country. And this is no insignificant thing. During the lockdown, especially in the south, there was a big demand on pets. People were at home for the first time in a long time, and those people decided to get pets. The demand for pets increased, the supply was rigid, so the price went up through the roof. So professional gangs started robbing pets across the country, and these people would go around to homes. They would mark a bit of chalk on the ground. They would tie maybe a string to a gate, and they would come back that night and rob pets, and then sell them in this country or abroad for maybe $2,000 or $3,000. And there were fines first, but the fines are not enough to deter it, obviously. So we've looked for a mandatory minimum sentence of 10 months. Because right now the law makes no difference between an inanimate object like a mobile phone and a family pet. And anybody who's lost a family pet will tell you that it's a big challenge to a family. It can be a bereavement when a pet dies in a family. So aim to launch that bill this week, and hopefully we'll have good news on that bill as well. We've launched about 7 bills now throughout Leinster, through Leinster House just since the start of this government, which is probably one of the biggest outputs of any political party, despite the fact that we are the smallest political party in the Dáil at the moment. But we're not, the smallest political party in terms of support. Our support is growing massively currently. If you look at the latest polls, it's putting us at level pegging with the Green Party, with People Before Profit. That's despite the fact that RTE and some of the larger news networks in this country still won't cover the work that we do and won't include us in the debates, which is like ridiculous given the size we are at the moment. And also, we are the only alternative political party with a different view to the establishment. All the rest of the political parties are standing in the same political space at the same time, and we're offering a different perspective, a different vision for how Ireland can be run. So, but that growth continues. And one of the reasons it's continuing, the main reason it's continuing, is because we have a phenomenal membership on the ground, a grassroots organization that is, immersed in the bread and butter issues of local communities. And, I'm hearing from people from Limerick to Cork to Mayo to Derry to Cavan to Monaghan who are saying if you need something done, ring Aontú. The other political parties are not going to do it for you. And that is more and more the case. So I want to give just a big shout out to the membership of Aontú for the level of development that's happened in this organization just in 20 months. It's an incredible thing that we are, reaching the same poll heights now as political parties that are, 20, 30, 40 years old, who get hundreds of thousands of euros from the state and, have loads of TDs, loads of councillors, and we're out punching them. And that's a phenomenal thing. And just to let people know as well, we don't get funding from the state. We rely on our membership and our supporters to help us out. We do have national draw tickets for sale at the moment. The time is running out. There's, I think, less than 2 weeks now till the draw. Some really decent prizes there, thousands of euros of prizes. And I would ask people to do their best to purchase a couple and maybe even sell a couple to their friends and family as well. You'll find that on our website, www.aontú.ie. Just hit on the shop and you'll go to the tickets there and do your best to purchase. And also, if you're one of those people who've been kind of, watching us grow, looking at our development, liking what we're doing, seeing the fact that we are, a really important organization for the future of this country, that we are unique with regards to our voice. Don't spend too long on that fence. Get off the fence. Give us a hand. Join us as a member, and that can be done very simply on the Aontú website there as well. Listen, the main bread and butter of tonight's discussion is the lockdown, and listen, it brings me no pleasure and no joy to have to discuss this again. Suffice to say that Aontú is the only political party that's giving a pushback with regards to this and an alternative view on this. Now, don't get us wrong. We're not saying that there's no such thing as COVID-19. There is, there is an illness called COVID-19. It's a new illness. We don't know much about it in many ways still. It has killed people. It has damaged people's health. It is in the society, and the numbers are obviously growing. So, we would say to people, be very, very careful and do your best to see can we keep this down. That includes wearing a face covering. That includes washing your hands. That includes, social distancing, working from home. Doing the smart stuff, the simple stuff, the low-hanging fruit. On a daily basis. But the problem that we find in this country is that there's very little debate on the big issue of COVID. We're now heading into the second lockdown, and the government strategy is to literally wait for a vaccine, and there's no guarantee that the vaccine is going to be available to the population of this country in the next 24 months. So the government have a yo-yo COVID strategy, which means in and out of serious lockdown. It is likely that we will come out of this lockdown in the first week of December. The figures will start creeping up over the Christmas period, and that by the end of January that we will be in a similar situation again. And there's nothing to say that won't happen again in April, that won't happen again in June. Now, I'm not saying that to depress people and to wreck people's heads. I really don't want to be pessimistic or dark on this. There's enough darkness there already. But what we're actually saying is there is no exit plan by this government other than a vaccination. The other aspect of this is the government said that we were going to have to live with this. Now, live with this means that we have to live with some level of risk. Now, what that risk is and what it isn't is a subject of massive debate. You can choose any number of scientists who will tell you that the risk is negligible or the risk is massive. But we do know that there's a risk there. But the point of the matter is there a balance or is the lockdown proportionate? And I would argue that the government are making a mistake, that there isn't proportion on this. And one of the first reasons, and I've said this over and over again, is the government is making a decision on half the information. They are not taking into consideration the number of people who are dying from cancer, from heart disease, from stroke, or from mental health issues. It's only 4 areas of health that are not being treated properly and have not been treated properly because of the orientation of government resources and health resources towards those issues. There is a danger, a significant danger, that the non-COVID excess deaths in this country could far outweigh the COVID deaths. The simple matter of fact is the government doesn't know. Now, I've asked Minister for Health after Minister for Health to do this, they won't do it. I've asked the head of NPHET and I've asked the head of the HSE to do this, and they won't do it. It is negligence to make a decision that is not evidence-based, and that's exactly where the government are at the moment. There's another aspect to this as well, that COVID and the restrictions are pushing hundreds of thousands of people. 200,000 people tonight will lose their jobs. Even with the PUP, that's still not going to make up for their income loss. Pushing people into poverty is a sure way to increase mortality and morbidity into the future. It means that they have to take on significant debt into the future. And it also has mental health issues too. So again, the government have done no research into the impact. In our pre-budget submission, we in AIM2 asked for a COVID impact assessment unit. We said that 1.5 million euros, that's all, should be put aside to assessing the impact of the COVID restrictions on society. The government wouldn't do it. So there are 200,000 women currently who have missed their screening with regards to cancer services. Even with the winter plan, which is a 600 million euro budget, the capacity within the screening systems in Ireland will only be 95% of what it was last year, before COVID. So that means they're not going to get near the 200,000 people who are on that waiting list. And that means you have delayed diagnosis and delayed treatment. That abnormal cells, precancerous cells, and cancerous cells will be missed, and there will be fatalities as a result. Now, last year, this country was rightly gripped with the cervical check screening scandal. But this scandal of lack of treatment, lack of diagnosis, and lack of screening will be felt in this country for years to come because of the government's decision. Now, what's really frustrating about this is we asked the government, Ireland is an outlier, first of all. Before lockdown 5, level 5 was introduced, Ireland was already a lockdown with the level of severity of our restrictions. Only Britain exceeded our level of severity. That's despite the fact that in terms of COVID, the incidence of COVID, we're a mid-ranking country in the EU as in terms of COVID. It's an incredible situation that even the WHO said that lockdown should only be for when your health service is being overwhelmed in an emergency situation. Stephen Donnelly was on the Claire Byrne show, I think it was Monday night this week, and said there is no crisis in the hospital service at the moment. The level of mortality, the level of ICU, and the level of hospital admission is far lower, thankfully, than it was in April and May. That's in no way saying that we don't want to reduce this further and we don't want to protect every life. It's really important to know that we do want to do that. AIM2 is founded on the basis of the protection of life and the protection of health and communities and enterprises and businesses and workplaces. We want to protect all of those things, but it needs to be done in proportion. So Ireland is an outlier. Why is Ireland an outlier is a significant question that hasn't been answered. And a perfect example of this, and hats off to Becky Keeley, who's our Cork Northwest representative, who's been running this campaign for us. There are 3 countries on the planet that do not allow for church services: North Korea, Saudi Arabia, and Ireland. Most countries in Europe have some level of restaurant and non-essential retail activities and pub activities at the moment, even countries with higher incidence than ourselves of this illness. So this country has taken a particular decision. That decision is going to be massively damaging. There will be costs to this as well. As we said, we believe that it hasn't been done on evidence. It has been done on the basis of half the information. Now, what's blowing people's minds across the country is this. When we asked the government why, they said, well, the Irish Health Service is not up to scratch with regards dealing with a potential wave. We've been talking about this issue for 7 months. The government announced a budget of 18 billion euros last week. Why in the name of God had the government not put in the capacity in ICU and the health service to be able to deal with this? It is criminal negligence that the governments have left the front line of this battle on the people of Ireland and not provided the necessary health resource to fight this. Absolute criminal negligence that's happened. And the government is spending billion euros on PUP payments. If they had focused some of that money on creating capacity in the health service, there would be no reason to actually have to pay those PUP payments. Our level of ICU is one of the lowest in Europe, and indeed it's lower now than it was 10 years ago. And we've been pushing for years for a doubling of ICU, and still the government has hardly moved the dial with regards to capacity at all on that, which is an absolute disgrace. So I suppose people are deeply frustrated with that issue not being tackled. Another point, and it was us in AIM2 that brought this information to the fore a number of months. The government, it's hard to believe, the government employed 2,000 tracking and tracing staff back in April and May, and then decided not to put them to work. Had only about 30 or 40 of them working. Didn't create any capacity in it during the summer. And now we find out this week that they've just literally thrown their hands in the air because it's got too unwieldy. They're not able to do it. In other countries, such as Germany, they've been able to isolate outbreaks, track and trace, deliver isolation very quickly, and quench the fire. And that's not happening in Ireland at all. So there are ways of battling this that doesn't cost a billions and billions of euros. There's a good chance right now that Ireland's debt will mushroom 200 billion euros to 300 billion euros because of this crisis. That will be a higher figure than the banking crisis debt that happened 10 years ago. It will be a debt that will be straddled on the shoulders of our children and their children for generations. We are robbing the future to pay for the mistakes of the present. And there's this sweet damn all debate about it, unfortunately. So what we're saying very loud and clear is that this is a real illness. We need to be careful, be cautious, do what we can to reduce the numbers, but the government needs to cop on to itself with regards how it approaches this issue, how it resources the health service to make sure we have capacity, how it resources tracking and tracing, and not closing down society over and over and over again. That's where we are with that. I mentioned about the north of Ireland earlier in the discussion. I've asked Simon Coveney and I've asked the Taoiseach this question. Where is the locus of cooperation between the north and the south of Ireland with regards to COVID-19? We hear in the media these wonderful stories about countries like New Zealand and Australia, which are islands, who have been able to, one, consistently deliver some level of policy internally in the countries, and two, close their borders to make sure that the illness doesn't come in. Now, this country has been talking about cooperation north and south for ages. Indeed, myself and Denise Mullen, who's our councillor in Tyrone, have been running a campaign to try and develop cross-border cooperation on this for months now. Anyway, I asked the Taoiseach and the Minister for Foreign Affairs, who's in charge of this? Is there a structure? Is there a secretariat? Is there anybody actually employed at all to coordinate? And the Taoiseach gave me, in political terms, a shrug. You know, he said, yeah, there's cooperation. We talk to each other now and again, but there is no structure at all. The answer he gave me was nebulous. It was ad hoc. It was the type of stuff that you do for well-meaning projects that don't really matter that much. If the government is serious about this, if the government is serious about creating an epidemiological island in which we can, you know, come to terms with this, the first thing it would do was make sure that we are working with our northern counterparts and that the northern counterparts are working with the southern counterparts. We had a Fine Gael minister at the start of this, when asked why they hadn't engaged with the northern representatives with regards to COVID-19, stated, wait to hear this, stated, we wanted to tell the Irish people first before we told the people in the north of Ireland. Like, what are two fingers to Irish people living in the north of Ireland to say something like that for a government Fine Gael minister? And it just shows you two things. It shows you the lack of respect and understanding they have for the Irish nation, north and south. And the second thing, how little they understand about, you know, trying to get to grips with this issue. Aontú are going to continue being the voice of reason on this, being the voice of opposition on this. We are the only party in opposition, unfortunately, to the government of this. There's one or two other TDs, independents, etc., who have been asking the right questions as well, and that's a good thing. We are going to be careful and cautious as well. That's what I have for you tonight. Before I go, there's just one thing I want to say. Our dear friend and colleague and comrade, Anne McCluskey, who is a doctor and councillor in Derry City Council, is standing down from Derry City Council this week. And we want to thank her from the bottom of our hearts. I know she hates when I start talking like this, so I won't leave it too long. We want to thank her from the bottom of our hearts for the work that she has done, one, for the city of Derry, and two, for Aontú. She's a founder member of our organisation. She's still fully committed to us and remains an active member with Aontú. And we're delighted that she has travelled this journey with us so far. We look forward to working with her in the future. Thanks very much for tuning in. As I said, we need your help. If we want to grow, we need members. Members plus activism equals change. Think about that. Sign up on the website. Ihawa